All right, I'm just going to speak about this proposal from leadership in the House. And mainly, the only person I've heard be vocal about this was uh, Leader Nancy Pelosi. It's a plan to keep millions of laid off workers insured. This is I'm going to read from a few sources. This is from Vox, who to me did a pretty pathetic bit of cover on this. But they it's basically going to be a proposal to subsidize, fully subsidize Cobra. Um, Cobra is a weird name, but it's essentially what Cobra is if you have employer-based insurance and then you are basically you're no longer employed with them, it allows an extension of you to stay on that plan. The only thing, and this is why people say Cobra is really expensive. It just allows you to stay on that plan. For instance, if you had Blue Cross Blue Shield, your company or your employer at the time was covering 80% of the premium, and then you had to cover the 20%. That's the portion that came out of your check. Now you're paying 100% of the premium. So instead of being kicked off the plan, you're allowed to stay on the plan, essentially, if you can afford that full premium. That's why people say it's so expensive, because now you're paying the unsubsidized portion as well. The plan that the leadership in the House is proposing is to fully subsidize it. To be more specific, it will be 100% covered. Um, the House bill would expand COBRA to cover 100% of the cost of a person's health insurance premium. So that'd be the full cost of the premium. If it was a $1,500 premium, you the proposal, the subsidy will cover that full $1,500. Um, it will cover 100% of the premiums for furloughed workers, temporary laid off workers whose employers have promised they will return to work when economic conditions improve and who still get health insurance through their employer. So that just means that if for furloughed workers, it's going to cover the 20% only, which I guess that's assuming that the employer is still picking up the 80%. So that's the only amount left over. So since it's covering 100%, um, it's to my understanding, it's just the talking points are, and it's mainly from people within the health insurance industry, is saying this is a simpler way of doing it. And people can keep their networks, and they can keep their doctors, and it's a, it's and they can afford it, and they get to basically, on the healthcare end, nothing's going to change. So that's the easiest way to do it. They don't have to worry about picking a new insurance plan. This goes further than what took place under the Recovery Act, American Recovery and Reinvestment Act, that happened basically soon after President Obama came into office. They only covered 65% at that time, and it wasn't as many people that were unemployed. I mean, there was like 8, 9 million people, I think, probably more, that were hit by that recession. We're already at over 30 million people now, and they appropriated $25 billion at the time during that last recession. I don't even think everybody even stayed on it. This is 100% coverage and a lot more people, and that's the funny part about these articles. They at no point even mentioned, cost. Typically, just to be unfair, the very progressive people within the party who say Medicare for all, or basically only those people, there is always a how we going to pay for it question at the beginning, the middle, and the end of the argument. It never came up for this, because apparently, like, there's no cost to it whenever we're subsidizing employer-based insurance, but there is a cost if you're just directly paying for it. I'm not even on the end of Medicare for all, but the coverage is not the same whatsoever. I have to call out that complete double standard here. I'll be honest, this is a pretty expensive approach to do it, and it completely undermines the whole point of passing a law called the Affordable Care Act, which means people that lose their insurance um, qualify. It's a special enrollment period. They get 60 days to join another plan through the marketplace, and that literally was the whole point of that, um, which would probably actually make more sense to put a provision that starts a new open enrollment, because you will get a special enrollment if you've lost insurance. What will not happen though is if you did not have insurance prior to that point, you didn't have credible coverage prior to that point. So there might be some people that never did anything during open enrollment. So I'm just calling out the negatives here that didn't that basically they probably are gig work or something like that, didn't do anything to open enrollment, so they don't qualify at all. And then they also don't have employer-based insurance, so they're completely, you know, gonna still not have any insurance. Is literally only covering, people that are coming from employers that offer employer-based insurance. And another drawback, if you have to change insurance, is your deductibles and everything resets, your max out of pocket, all that starts over. If you have a medical condition and you already burned through your employer $750, $1,000 deductible, then yeah, it definitely is a pain to start brand new insurance. And then, when those deductibles in the marketplace are much higher, depending on where your income is at. So I totally get that. So that's a pro, for continuing the coverage. And also it can be the transition. Depending on where your income is at, everyone may not even qualify to stay on the same plans. The kids may fall onto Medicaid, and then the adults may have to go into a marketplace plan. Yeah, it will be much simpler to just say, you know what, keep them on the employer-based insurance. Only thing is, it's a really expensive approach. And it totally, as the American Prospect covered, which just makes a lot of sense. This proposal was not just thought of by leadership in the House. Um, this came from a list of a list of proposals from American Health Insurance plans, and who is a lobbying group for health insurance, and Blue Cross Blue Shield. The CEOs apparently proposed this, and Blue Cross Blue Shield has a large market for employer-based insurance. They typically aren't, I know in my state, aren't the most competitive when it comes to the marketplace. So yeah, the government fully subsidizing their premiums. I mean, you would think, or something of this nature, you'd be like, okay, cool. The government's going to fully subsidize you. Hey, then we want a reduction on how much you're charging. Some type of deal, something like that. Because this is a total cash handout to group insurers. That's really it. And also, who else likes this? Yeah, providers, hospitals, because even said by a senior policy advisor, it's the reimbursement rates. This proposal should be favored by providers since it will increase their likelihood of receiving higher commercial rates from these workers. That's just fancy talk for medical treatment. They get paid more. The typically commercial or private insurance pays a lot more than government insurance, which government options will be Medicare, Medicaid. They prefer people to stay on the private insurance because they get more money. The providers. So I mean, another point that was left out of Vox, they just kind of covered it. Basically, did not mention the campaign donations that the DCCC took as well. That, I mean, quite frankly, the RNC and the DNC and the DCCC and whatever the NRCC, they're lobbyists for the Democrats and the Republicans. They both take a ton of money. And maybe the only thing I can think of is leadership in the House thinks this will probably be the easiest thing we can get through because the Republicans take the corporate money too, and the insurance companies, and we take it too. So the expansion of Medicare or something like that, that's not going anywhere. So maybe this is what it's to me, just undermines what was fought for, completely. And then also, it's just a really expensive route to go. Um, those those premiums were not subsidized by the companies, by the employers. Really expensive. there is a good possibility, especially depending on how much people make. They can go into the marketplace. The government will save more money. They will pay a lower tax credit than what would have been paid to subsidize the employer group insurance. Um, and yeah, maybe some people do qualify for Medicaid. It's pretty, it's that may be the case, but why is that cheaper? Because yeah, you only pay for it's they may not use the plan. This right here, we're just subsidizing something for some people that may not even be used. That's a good thing, but it's a lot of money to me. It just makes, like I said, $25 billion appropriated for a fraction of how many people will need it this time. Well, we'll see what takes place. American Prospect, prospect.org. I'm actually going to put a link in here. This actually gives, I, I try not to, I try not to be a partisan hack like a lot of other people talking about these things. Yeah, it came from the lobbying groups. It was basically copy and pasted by the House leadership Democrats, and I haven't heard from Chuck Schumer, but I doubt he have an issue with this as well. So it's not like it was like Vox said, the Democrats came up. No, no, the insurance companies and the executives came up with this idea, and they're asking for a bigger amount of money than they got last time around. Well, while the treasury is getting looted, apparently, everyone's trying to get their hand in there.